Hello, everyone, and welcome to my speech on postpartum depression. Imagine spending months preparing to welcome a new baby into this world. Friends and family congratulate you, your home is ready, and everyone is expected to be one of the happiest times of your life. But after your baby is born, and instead of feeling joy, you feel overwhelmed, anxious, emotionally exhausted, and disconnected. You begin to wonder if you're a good parent, but if you're afraid to tell anyone because you're worried they'll judge you. For many women, this is the reality of postpartum depression. So the purpose of my speech is to inform you about postpartum depression, explain how it can affect the relationship between a mother and her infant, summarize recent research findings, and emphasize why early recognition and support are so important. Postpartum depression is one of the most common complications after childbirth, yet it remains widely misunderstood. Why many people assume that every new mother immediately feels happy and connected to her baby. However, for many women, the weeks and months after giving birth can be filled with sadness, anxiety, guilt, and emotional distress. Because these feelings are often hidden, postpartum depression frequently goes unrecognized and untreated. The primary research articles I reviewed is titled The Impact of Postpartum Depressions on the Early Mother's Infant Relationships During the COVID-19 Pandemic. Perception versus Reality by Richard and colleagues, published in 2024. The purpose of the study was to examine how postpartum depression affects the early relationships between a mother and their infants by comparing mothers' self-reported experiences with research observations of mothers' infant interactions. Before conducting the study, the researchers expected mothers with postpartum depressions to report greater parenting stress, weaker emotional bondings with their infants, and lower quality mother and infant interactions than mothers without postpartum depression. They're also expected these differences to be reflected in both mothers' self-reports and researchers' direct observation. Today, I will discuss the three main ideas. First, I will explain what postpartum depression is and what causes it. Second, I will summarize the study methods and findings. Finally, I will discuss why recognizing postpartum depression early is important for mothers, families, healthcare professionals, and our communities. So my first main idea is understanding postpartum depression. Understanding postpartum depression is often referred to as PPD. Is a serious mental health disorder that develops after childbirth. It is different from the baby blues, which many women experience during the first few days after delivery. The baby blues usually involve mild mood swings or sadness that improves within 2 weeks. Postpartum depression, however, is more severe and can last for several months or longer without treatment. Common symptoms include persistent sadness, anxiety, excessive crying, fatigue, mood swings, difficulty sleeping, loss of interest in activities, and changes in appetite, feeling of guilt or worthlessness, difficult concentrating, and trouble bonding with the newborn. Some others are also feel emotionally numb or question whether they are capable of caring for their child. In severe cases, postpartum depression may include thoughts of self-harm or harming the baby, making immediate medical attention essential. Researchers believe postpartum depression develops because of several factors working together. After childbirth, hormone levels such as estrogen and progesterone rapidly decline, which can affect the baby's brain chemistry, and mood. Other contributing factors include deprivation, physical recovery after labor, previous depressions or anxieties, financial stress, relationship difficulties, or lack of family supports, and a major life changing associated with becoming a parent. According to the Center of Disease Control and Prevention, about 1 in 8 women experience symptoms of postpartum depression. Despite how common it is, many mothers have sought treatment because they feel embarrassed, fear being judged, or believe that their feelings are simply normal or part of every parent. My second idea are the research findings. The research studies was conducted during the COVID-19 pandemic, a time when many new mothers experienced increased isolation, stress, and limited access to healthcare services. The researchers recruited mothers with infants between 6 months of age and between 2 and 6 months of age. Some participants had postpartum depression, while others did not. To better understand the mother's infant relationship, the researchers used two different methods. Mothers completed questionnaires describing their emotional well-being and parenting stress and feelings of attachment towards their infants. Researchers also directly observed mothers interacting with their babies, paying attention to their behavior, such as eye contact, responsiveness, communication, and affection and nurturing. The findings partially supported the researchers' expectations. Mothers with postpartum depression constantly reported higher parenting stress, greater feeling of guilt, lower confidence, and more difficult bonding with their infants. Many people believed that they were good mothers and felt emotionally disconnected from their babies. However, researchers observed something very different during their mother's-infant interaction. Although these mothers described themselves as struggling, many continued to comfort their babies, respond appropriately to their needs, smile, to maintain eye contact, and to demonstrate a warm, nurturing, caregiving behavior. Because of these findings, the researchers concluded that the healthcare providers should never rely on observation when assessing postpartum depression. Instead, they should ask how mothers are feeling, because emotional distress is not always visible. My third and main idea is why early recognition matters. Understanding postpartum depression is important because it affects not only the mothers, but also their families and their support systems. When postpartum depression goes untreated, it could interfere with the mother's ability to care for herself, increase stress with the family, and make everyday responsibles more difficult. The encouraging message from this research is that postpartum depression is treatable. Early recognition allows mothers to receive counseling, support groups, cognitive behavioral therapy, medication with appropriate and additional family support. With proper treatment, most mothers recover and continue building healthy relationships with their children. This topic is especially meaningful to me because I plan to become a registered nurse one day. Nurses are often among the first healthcare professionals to interact with the mothers after childbirth. They have an important responsibility to recognize warning signs, screen for postpartum depression, educate families, provide emotional support, and connect mothers with appropriate mental health resources. Perhaps the most valuable lesson from this research is that we should never assume someone is doing well simply because they appear to be functioning normally. Many mothers continue caring for their babies while silently struggle with depression, anxiety, or overwhelming guilt. Simply ask someone how they're feeling, listen without judgment, and encourage them to seek help can make a tremendous difference. Increasing public awareness also helps reduce the stigma around postpartum depression. When family and friends and healthcare providers understand that postpartum depression is a medical condition rather than a personal weakness, mothers are more likely to seek treatment and to receive their support that they need. So today I discussed three main ideas. First, I explained why postpartum depression, including its symptoms and common risk factors. Second, I summarized a recent study by Richard and his colleagues, which found that although mothers with postpartum depression often experiencing greater parenting stress and feelings of disconnection, many still demonstrate warm and nurturing behavior towards their infants. Finally, I discussed why recognizing postpartum depression early is important for mothers, families, healthcare professionals, and society. The most important takeaway from this speech is that postpartum depression is a serious but highly treatable condition. This research reminds us that as a mother, emotional struggles are not always visible, and that we should never assume someone is doing well simply because they appear to be coping well. By increasing awareness, reducing stigma, encouraging open conversations, and providing compassionate support, we can help mothers receive the care that they need, promote healthier outcomes for both mothers and children. Thank you for the time, and see ya. Oh, and my references for some of the pictures. Thank you.